Okay, we're going to discuss what has been known as a traveling bandage. These are a bandage that you use to prevent infections, and it's especially important when you don't have time to seek medical attention. Let's say you're out in the field or you're nowhere near a hospital and you have to do a lot of literally traveling. These are bandages that will stay in place for a very long time and prevent infections. Well, the first thing we're going to want to do is clean up the wound and get whatever we possibly can out of it. And you always want to make sure that you're cleaning away from, so start in the center and pull out. You can see it's pulling off from there, and clean up those areas really good, exterior, surrounding, and then you're going to want to use hydrogen peroxide or a sterile water compound or whatever, and make sure that that wound is actually rinsed out very well. Make sure nothing's getting in there. Okay. At that point, after the wound has been cleaned out and we're making sure that there's no capillary bleeding, then we're going to want to pull the wound apart.
What's capillary bleeding?
Capillary is surface bleeding, no arterial bleeding. There's no arteries or any kind of large veins. So here we go again with the honey again. So first thing we want to do is pull the wound apart and make sure that the honey gets down into the wound again. Once the honey is down into the wound, then we've discussed onion skins before. This is where an onion skin becomes incredibly important. We're going to want to make sure that we get just a slight bit of honey on the exterior of the wound to act as a sticking agent for the onion skin. The onion skin actually stops any exterior bleeding and makes sure that nothing goes in or out of the wound area. So we'll place the onion skin on top. And from that particular point, we're going to use it's a miniature Kotex. It's a panty liner. Use a panty liner. I particularly like panty liners and Kotexes for large trauma areas. At that point, we're going to want to put a maxi pad over the top of it. So our first when we tape this up, we're going to want to tape it in the direction of the wound, because our bandages are laying with the wound initially. Can you hold that? Hold your arm up. Yeah. Now this is where you want pressure, but not pressure great enough to cut off circulation. Okay. Then we're going to want to tape it in place so it doesn't move up or down. So remember, we have onion skin under there, a panty liner on top of that, and then a Kotex above that. This will breathe a little bit. You're going to have to tape this down with whatever means available to you at the time, so it doesn't move. If you're in an area that you're not going to have medical access to or any ability to dress this wound later on, you might want to put a small piece of saran wrap over the top of it, or tape some kind of plastic over the top of that just to hold it in place. This will act as a moisture barrier to keep moisture from getting into it. If you're not going to be getting wet for any time too soon, you're in an area that an Arctic area, someplace where there's plenty of clothing above the wound or exterior to the wound, you're not going to need to cover it anymore. So it's called a traveling bandage because there's just no way to get in there and clean it on a regular basis. So we're going to assume that we're not going to be getting it to any kind of medical treatment for any length of time. And we need to use this limb. So the honey will keep it pretty well clean. Should be pretty well cleaned out from there. The onion skin, if it does start bleeding again, it will act as a coagulating agent. When you take the onion skin and the bandages off, you're going to want to make sure that they've been soaked in a sterile solution prior to removing especially the panty liner and the onion skin.
What kind of sterile solution?
Distilled water works the best. Hydrogen peroxide, any kind of iodines or chlorides that come in medical kits. Distilled water actually works the best of any, or hydrogen peroxide.
So it's a traveling bandage. What kind of material would I need to take with me out on these trips where I would go?
Some tape, some gauze, panty liners, some Kotexes. Those will take care of your larger wounds, and of course you're going to want. You can put your honey in small tubes, so you can use it as you need it, and just get. They come in. The honey you can actually put into like small medicine tubes that you can get at any kind of medical store. You can just inject the honey into those and use them as you need them. But you're going to want to rotate your honey out about every 6 months or so. So carry a bunch of Band-Aids with you, and your Kotexes and panty liners and things of that nature, or large. If you can afford the gauze or have access to large gauze pads, that works pretty good too. But these will get you through the day. They're usually good for about 16 hours of activity before something has to be done to them. And as the honey starts to dry a little bit, it pulls the wound together so it can't come apart. So the honey will act as a gluing agent as well as an antibacterial agent.
Right on. Well, let's see what our time is at. I need to get a little timer, like a little cooking timer or something that says 10 minutes. We have about 1:20 left.
Oh, that's okay. You guys got any questions?
So you recommend actual gauze if you can get a hold of it?
Yeah. The advantage of the panty liners is the fact that they're cheap, they're sterile, and they do a tremendous job of absorbing blood. That's the part I really like about those.
What they're made for, yeah.
So if you have a really large arterial wound, not an arterial wound, but a very large wound where it's bleeding excessively, and you don't have time to do a complete compression blood stop, you can put on your Kotex pads rather tightly, and they will absorb, and you can get them off, but they will stop the bleeding.
Right on. We'll see. Well, that's about 30 seconds left if you want to do anything.
Well, I'm good.
What about ripping hairs? Should you shave around the wound first, or if you
No.
have a chance? No.
No, if you rip hairs, that's fine. That's going to be the least of your worries. You know.
That's all right. It's over.
If you've got